Okay, so hi all. So welcome to the today's seminar regarding the medical coding training. So myself, I'm Sunitha. I have total of 10 plus years of experience in this medical coding field. So today's our agenda is like who can take up this course and like what is medical coding, all those things I will be explaining in this today's agenda. So who can take up this course? So this course can be taken by any life science graduates like biotechnology, microbiology, zoology, B pharmacy. So any life science graduates can take up this course. Not only life science, but also non-life science can also take this. But how the company will hire means you, even though you are a non-life science graduates, but you need to have a skill on this medical coding training as well. You should be a certified person. Then only the company will be hiring the non-life science graduates. And also like who are freshers, final year students who are recently passed out for that particular year. So for them also they have lot of opportunities, but only if they are certified only. So like how in IT, they will be having some certifications. Even though for IT, they are doing certifications are not least bothered. But here in this medical coding, compulsory certification should be there. Then only the company will hire the certified persons. Now, where does a medical coder will work? So generally, the companies like healthcare companies are there. So in those companies, we will be working. Like we have Optum, Omega. So all these are top leading MNC companies. So in those companies, we will be working. And coming to the other countries, like Dubai, Abu Dhabi. So in those countries, we will be working in the hospitals. Even though it is in the hospital, we have a separate setup for medical coders. And then next coming to like nowadays, some IT companies are also getting this medical coding clients, projects. So they are hiring for the medical coders. And as your experience is going on, you can also do the work from home job also. Next comes like what is medical coding? Medical coding is nothing but the patient's health information. Like for example, a patient is going to the hospital. So doctor will write all the things, right? Like what is the patient's problem and what kind of diagnostic test they have to undergo. So all those things are converted into the ICDs and CPTs format. So like this, for example, abdominal pain is there. So we will be converting into the ICDs and CPTs like this. As you can see for abdominal pain, we have to assign R10.9. And here, no need to remember any codes because the softwares are there where they will give all the codes. You just need to enter this. You have to like assign the code. The software will itself will give the code. No need to keep any kind of remembering kind of thing. Everything is inbuilt in the software. But the only thing is we have to give the correct code. Why? Because in this abdominal pain only we have so many codes. What is that exact thing you have to code? That is the thing. As a medical coder, you have to assign the exact code. Then next comes like how the process will be in the medical coding. So first, the patient will go to the hospital and the doctor will write the prescription. And then as a medical coder, you will be getting the reports, healthcare reports, and those reports you have to read and then you have to assign the codes like this. For example, patient is having pneumonia, so you have to assign a code for pneumonia in the softwares. So generally, like we will be working for the insurance company. So the insurance will pay the amount to the physicians. So insurance means the India companies, the India healthcare companies, they will be working for the hospitals and the insurance companies. Why? Because we are getting the clients from the US and other countries where the hospital people and insurance will be tied up with the clients here in India, and we will be getting the projects. So for the US hospitals and insurance companies, we will be getting the projects in India, and we will be working for the companies here in the healthcare department. And then from the insurance, the physician will be getting the amount. And then this complete process, we will call it as a revenue cycle management. So the three people are very, very important in this. One is patient, the other one is the provider, and the insurance. Why? Because in US and other countries, the patient will not pay directly the amount to the provider. Then who will pay? The insurance will pay the amount to the providers. Okay, so overall, we are currently working for the US based clients and also for the other country clients also. So we will be getting the reports completely, which are electronically healthcare records we will be getting, and we will be giving the codes. So this complete process, like how the physician is getting the amount from booking an appointment to the hospital and full payment to the doctor, how it is the complete process. So this process, we will call it as a revenue cycle management. So first, the patient will get the registration, and then the insurance will verify it, and then the patient will visit the provider, and the patient will get the service, and the complete, like whatever the information is given by the provider, it is converted into the medical medical codes. Who will give this medical codes? Nothing but the medical coders. And then the claim will be processed, and then the payment will be given to the provider by the insurance companies. So now, like what kind of things we will be learning in this medical coding training part. So the first thing is the basic medical knowledge. Basic medical knowledge is nothing but like what kind of language the provider will use it. So what kind of language the provider is using. For example, like in generally we will call stomach, right? So the provider will use the stomach as gastro. So those kind of terminologies we need to have a good knowledge. And then next comes the anatomy. So as a human, we have 11 organ system. So those organ systems, we need to have a knowledge on this. And then next comes like ICD codes. See, for example, patient is having diabetics. So what is the code for that? So like this, we have some certain guidelines and certain rules, how to code this. So those guidelines we have to follow. So similarly with the surgeries also, whenever patient is undergoing any surgeries, so for those surgeries, we have to give the codes. So how to give the codes also, we have to give the like we have to follow certain rules. So those rules we are going to learn here. Similarly for the HCPCS also. These are non-physician services. I mean, like for injection drugs, we have to code certain HCPCS codes. For this also, we need to follow the rules. So all these rules and guidelines, we will be learning in this medical coding training part. So as I said, no need to remember anything. Everything will be there in the software. Up to learning part, I mean like for training purpose, we will be not using these tools. We will be using the books. Okay, when we will be into the job, we will be using the softwares like icd10data.com, Codify, Encoder Pro, 3M softwares like this, the tools will be there. And then next comes like the certification parts. So once we will be completing the medical coding training, we need to write the certifications like CPC, CCS, whatever is required, you can take up. So, but the important foremost certification is the CPC certification. So this is one of the best certification to do. And how the career will be there in the medical coding. So there is a high demand and so many opportunities. I mean, like global opportunities are there. You can work anywhere, and you can also work remotely also. And even though AI has come, the medical coding jobs are not impacted. Why? Because it won't give accuracy percentage of coding of out of 100%, it may give only like 50%. That's it. But the remaining 50% has to be done by the human only. So that is the reason, even though AI will come, it doesn't affects any kind of jobs, especially for the medical coding. Next comes like what kind of the job roles are there. So we have fresher, senior medical coder and auditor, team leader. So like this, you can grow up in your career in this medical coding, and the salaries will be like from 16 to 85,000 and so on. Like once we are an experienced person, and as like you are growing up in the career, like manager, director, the salary will be increasing. And then I suggest like to take the certificate from institute itself. Why? Because we provide a structured course with experienced persons only. You will be undergoing the training, and you will be also like hired by the companies. Why? Because the companies are nowadays, they are hiring for the persons who got certified from the institute itself instead of taking self certification. And once the training is completed, we will be also like making you to prepare for the resume, and also we will be conducting the mock interview, how the interview will be there and all those things. And here we go, we have some list of medical coding companies in India and all over the world, like Coro Health, Optum, Claris, Sutherlands, Coronis, AGS Health, Access Healthcare. So many companies have come up in the recent 5 to 8 years, as we are getting so many projects from the US clients. So these are some of the list of the medical coding companies. And coming to the job locations, Bangalore, Hyderabad, not only in India, but also we do have international opportunities also. You can work anywhere because this is a universal language. This is a universal language. And do you have any questions?
Yes, I do have, Sunitha. Thanks for giving the detailed demo. Can I ask questions?
Yeah, Shreya Agarwal, you can.
Yeah. So I have a couple of questions. My first question is, from how long this medical coding has been into the market? I mean, when was it introduced? From how long this has been into the market overseas, globally, and in India, basically?
You're asking the time period, or like
I mean,
you are
for how
asking
many
the
years it has been into the market in India and globally? Because we haven't heard about medical coding before few years, and
in,
recently it has started
in,
emerging different portals who are providing the training. So
in
just curious to know that.
India,
Yeah.
okay, in India, since from 15 years, we have medical coding. Since from 15 to 20 years back, the medical coding was there.
Okay,
I
but
can say
we.
exactly 20 years. Since from 20 years, medical coding, because as of my knowledge, since from 20 years, medical coding is there.
Okay, but we haven't heard of much about it unless
Yeah,
past.
because why? Because people are not having awareness. Nowadays, the medical coding, we are having lot of awareness. People are saying medical coding jobs are there a lot. Like that, we just got to know, okay, through the mouth talk itself, people have got to know about this medical coding, and they are like want to know what is medical coding. So in that way, they are getting an awareness of this medical coding. It was there since from 20 years, but people were not aware of this.
Okay. My next question is, like you said that there is a chain of processes. The patient goes to a doctor, doctor prescribe the medicines in the form of prescription, right? Then it comes to for the role of this medical coder, where that it translates or it prescribes into the form of coding, and then how it is processed to the insurance vendors, right? But while I
Exactly.
see the mode of insurance claims in India, we have never noticed or seen that any kind of medical coding comes into the picture while in the claim of reimbursement from the.
Nowadays in India also medical coding is there for few of the insurance companies. Nowadays medical coding is there where the insurance companies will give ICD coding. See, for
Mhm.
example, I just got a delivery in one hospital.
Okay,
Okay, let's take example. I just
sure,
got
sure.
a delivery in hospital. I gave birth to a baby. Me
Hmm.
and my baby are sick, so we have to stay for 10 days.
Okay.
Okay, after 10 days, I'm getting admitted, I'm well and everything. So instead of I'm paying the amount, my insurance is going to pay the amount. And how the insurance is paying the amount immediately? So the surgery, whatever surgery for me has done, like C-section, and my
Hmm.
baby was, let's take like she was in NICU for 10 days. So all those NICU services, whatever they have done, and my C-section surgery, all these are converted into the coding format. Codes format it is converted, and then the insurance will give for that particular code some $500, $400, like that the insurance will give the money to the hospital. Okay.
So is it like someone is already sitting in the insurance companies who is taking care of this particular piece of processing into codes, and then it is being passed to the finance section for the reimbursement?
No, that's what I'm saying,
Hmm.
not the insurance people. So
Hmm.
they will be converting all this health information into the electronic form where
Hmm.
the medical coders will receive it, and they will be converting it. Medical coders will be there, they will convert it.
Ha, so I mean, these medical quarters will be employed by whom? It would be by hospitals, right?
No. Hos-
I mean, who will be that party where medical quarters will be working with? That's my question. Sunita, you are on mute if you're speaking.
Yeah, one second.
Yeah, sure.
Um, Hello.
Yeah, yeah.
Yeah, Agarwal. So what you were saying, like basically we are going to work for the insurance companies, or we will be working for the, how you said, I did not get you.
No, what I was saying is, you said medical coders comes into the picture before the insurance claim part, right? In India as well.
Yes.
So
Yes.
my question was, who will be employing these medical coders before this process? Would it be the hospital where you cashless reimbursement is going to happen, or would it be somewhere by the insurance companies who is going to process it, or somebody else? So we are not aware of in India where are these medical coders. Maybe they are working in the backend form. We are not able to seeing it, but I am curious to know who employs these medical coders in India.
Hello. Sunita, he's trying to say like who will hire us. So if someone gets certified about the medical coding, so then who will hire that people, those people? So mainly that is the question.
See, generally, like who will hire us means the healthcare companies. That's what I said, right? Like if you see here, these are the healthcare companies. So these companies will be getting tied up with the insurance companies. So these are the healthcare companies. They will be like tying up with the clients, insurance clients, hospitals. So we are going to work for this and they will be hiring the medical coders.
Yeah, so if I'm understanding it correctly, Sunitha, so this looks like more of a the companies which is being listed here, right? More of a on a US geography or the outside India.
Yeah.
So maybe it's not highly renowned in India as of now. Maybe these are
Yes,
mostly taken in the US because I was being deployed in the
exactly.
US healthcare project as well in my past. So we
Exactly.
that there is a lot of softwares where before the claim processing, the certified body comes into picture. There is a lot of things that they need to validate it, right? So this
Yes.
looks maybe in other countries it is more or relevant.
So maximum we have in other countries only. In India, it is like nowadays we are getting.
Hmm.
Nowadays, it is like in India also we are getting this kind of things, but maximum 90% we are going to work for the US companies only, US and other countries.
Okay,
So
all right.
all these companies, healthcare companies are tied up with the US clients.
Okay, okay. Yeah.
But nowadays, in India also, people are getting like most of the people
That's
in
what.
most of the cities, people are getting insurance. So there are also these things could be utilized.
Yes. Nowadays in India also we are having this medical coding kind of thing for insurance companies. Still any more questions?
Yeah, I
Agarwal
just
and
wanted to know like what is the background like I have to have like if someone wants to enter into this medical coding sector. So what is the
e-
background he or she
e-
uh, should have? Yeah.
any background is fine. See, like whether you are a life science or non-life science, it doesn't matter. But like
No, I'm
nowadays
just
what
asking
we
because some qualification, minimum qualification will be required, right, to get a job in market, right?
yes.
Yeah.
Actually, how means some companies they are asking for only life science, but for some of the companies they are hiring non-life science also. But non-life science also in scenario where they are hiring once they are a CPC certified coder only. So to have a CPC certification, that's what we are bringing this medical coding training program. So once, even though you are a non-life science, but once you will be undergoing this training part and you are a certified person, then definitely like you may get a opportunity.
Okay.
So
But how
Sunitha,
much percentage for freshers level opportunity? Like if someone just learned the things and he wants to enter into this sector, medical coding. So what is the opportunity, like chances of, like, is there any particular portal or
Yes.
some already
For now,
existed from there they can apply
let's
and
take
yeah.
like life science students, 70% chances are there. 30% chances are there for non-life science.
And any particular portal, like from there they will get the call if they upload their resume.
Naukri is there, LinkedIn is there. Like once you are a certified person in the medical coding, directly you can upload in the Naukri, LinkedIn like that. Definitely you'll be getting a calls.
Okay, only that social platform like where everyone is utilizing. So there is no particular platform related to this medical sector. Okay.
The specific platforms are not there.
Because why I'm asking, because in India we have a very less opportunity
Specifically
related to
means
this.
like
Yeah.
we do have some kind of general like how you might be having IT groups in the Instagram, Telegram, same thing we do have in the Telegram, Instagram, where they will be posting the jobs for the coders, medical coders. So like that, we do have some other platforms also where you can get to know about the job openings.
Actually, the most of the companies are from foreign based companies, not in India. So that's my concern, like whether
See,
they will have the access if they have.
that's what,
Yeah.
listen. Even the foreign companies only, but we are working for them only, right? The companies are here, India companies only. We are working for the US.
Yeah, so that's my question. Like lot of
Now,
companies
here
get
we have a list of companies, right? All these are India companies only, where we are working for the US clients. But some US companies also, we are working here in India, like Optum is there.
So
You
Vikram,
mean to say like the foreign company who have already tied our in Indian based companies? So maybe those companies will hire us.
Yeah,
Correct?
India based or also they're like IKS, R1, RCM, India based are also there. Apart from like US companies, we do like have India based companies also, like R1, RCM, and then IKS. So those are India based companies only. It's not like only US companies are there. We do have India based as well US based companies also.
Okay.
So Sunitha,
Yeah.
if I'm understanding it correctly, to Vikram's question, so basically, you are saying the companies might be from the foreign, but they do have their offices in India, and where the
Yeah.
people will be hired and employed.
Exactly,
So the way we have
exactly.
Yes. So that's
Cognizant,
it.
you have heard of Vikram, right?
Ah, exactly,
Mhm.
So IT
exactly.
companies, Cognizant is of US based,
Exactly.
but it is in India,
Nowadays,
different locations.
exactly. Nowadays,
Yeah. So
Cognizant,
that's it.
not nowadays, since from 3 years, Cognizant is getting medical coding projects.
Mm-hmm.
Cognizant is the one IT company where they are getting medical coding clients. Since from 3 years, COVID time, I'm observing like we are getting so many openings in Cognizant. They are hiring for the medical coders.
But I have another concern, Sunita, on the similar line, what you said, like Cognizant is hiring, though it could be hiring, but the pay scale which is being offered for medical coders is quite less as compared to what IT professionals are offered.
Yeah,
By
that's
when I
true.
say this, what I mean to ask is, usually we say on Naukri.com they are offered 25,000, 30,000, 40,000, just like that maximum. So is it like the pattern that this is just the maximum reach in this area, in this particular job of medical coder, or what's the
See,
potential, highest potential? Yeah.
it's not like you won't be stick to 40,000 only. Once you will be like going on, like you're having the experience, the salary will also increase. And also in this, we have some specialities also. So in the medical coding itself, we have departments. So as your department varies, your salary also varies. Like let's take for example, inpatient coder will be there, ENM OP coder will be there. Okay, so two persons are there. One is IP coder, one other person is OP coder. So OP coder will be having 35,000 and IP coder will be having 1 lakh per month. So it varies on the specialities also, departments.
So like you said, IP coder may get 1 lakh salary, but with how much of experience? Is it 10 or 15 years or how much?
1 year, 1 year, 2 years.
Okay, no, because the slides which you shown us earlier, na, I was just referring to those. There it
Hmm.
shows 85,000 for a 10-year experience or 8 plus years experience.
Yeah, yeah. So I did not added that. Why? Because again, people will be getting confused. So, like generally 35,000 as a fresher it will be. But like if you are going into specialty like IP department,
Mm-hmm.
even though you are having 1 year or 2 years experience, they are taking the salary take home as 96,000 per month.
Mm-hmm. Okay, just curious to know more about this because that is a reason that attracts the candidates to enroll in this particular area, Sunita. So, what is the maximum potential we have seen in terms of salaries people are getting in India in terms of take home? What is the maximum salaries you have seen noticing people taking while doing this course certifications with DurgaSoft? So, what is that your experience so far? Along with the experience they hold, what has been your
See,
observations
as a manager, they will be getting 20 lakhs also.
per month?
Yes, yeah, not per month,
Hmm.
Not
per
Okay.
per month,
annum,
per year. Yeah.
Hmm.
per year, per annum.
Mm-hmm. So when you say a manager, coding manager, I mean, how much experience that coding manager would be having?
Easily, it will be 7 to 10 years.
Okay. Okay, I got it. I mean, that's how I was just comparing with the different domains in the the departments. So this is comparatively a bit low as compared to the the other sectors. But yes, I get it. Also,
And you know what? This is the only one I can say recession-free industry.
because in IT,
Actually,
in
the thing
case
is, this,
the way Bikram took the example, he is from Deloitte. So if somebody is getting into Deloitte, even a 2 or 3 years experience would be getting that the one who is getting after 10 years in medical coding. That's how I was just relating with that. Yeah, yeah, Bikram, you.
Yeah.
yeah, but actually the thing is like, yeah, I do understand like in IT sector, if anyone is working as a developer, so they get more salaries. Okay, but I think Sunita is trying to say like this is the like fast growing market in India,
Yeah,
and
yeah, I understand.
nowadays like
Basically,
so yeah.
basically, this is a kind of a niche market which may not have a too much of potential in terms of salary, but at the same time, it may not have the impact of too much of recession as well.
Correct.
Yes, if you
Exactly.
once enter into
Exactly.
this particular
Exactly what
sector,
you said. Correct.
yeah, people will not have that much fear like during season they will lose their job. So
But
that
the
much
name
security they
suggests
have.
medical
Yeah.
coder, Sunita. Just curious to know, it's the name suggests medical coder, and but it doesn't have to do anything with the coding. Actually, it is more of a mapping of the codes with the
Hmm.
kind of symptoms of our disease, right?
Exactly. Perfect.
Because the way we call it coding in the IT, that's quite different. Here, the coding there is nothing as such coding. It's just a mapping of the codes, the symptoms, right?
Yeah,
Exactly.
that too also I got confused. When I heard about the medical coder, I thought that it will be some related to some like
Let's take
medical
for
application build kind of. Yeah.
But you also said one more important thing, Sunita. You said that you don't have to remember any codes. You just need to type abdominal pain, ABD kind of thing in a drop down kind of thing,
uh,
being expecting,
once
and the code will come. Huh?
yes, I'll show you that also. 1 second. Is it- See, like in the jobs, we'll be having like this kind of softwares where like we have to type what is the problem and then you will be having the search. So like this in the abdominal pain itself, you will be having unspecified upper abdominal pain, lower abdominal pain, generalized gas pain. So exactly what is that the physician has given, you have to give that ICD code. Let's take they have given upper abdominal pain. Now, what is the code here? R10.10. Okay, R10.10. So, in this way, again in this we have again specification right upper, left upper like that. What is the exact code? You have to assign the exact code. If you are leading a wrong coding, it gives um, what can I say, like a wrong way of payment. For example, you are giving right upper quadrant pain instead of left. So instead of giving $10, the physician may get $5. So whenever we are coding, it should be 100% accuracy code. Why? Because it may leads to a wrong way of payment to the physician. So that is the thing I can say exactly. So like this,
Basically,
these are the
company will
software.
lose their money.
The company will lose the revenue. The client will get the
Yes.
less revenue if we're giving the wrong way of coding.
And Sunitha, which pathy basically more related with this kind of coding? Is it allopathy or homeopathy or Ayurveda? Basically, which companies do we target? Is it allopathy, right?
It looks like it's allopathy only. It's ICD code based on the
No,
allopathy
but basis of the
medical.
code, this is kind of observed in homeopathy as well. They are very specific to right upper quadrant or left upper quadrant. This is in relevance, but not in India. So that's the reason I'm just curious to know, Sunitha, where is this more required? Is it in allopathy in the countries, other countries?
In English medicines, like I can say allopathy.
Mm-hmm.
Yeah, because see, like all the insurance companies, about this medical company, insurance companies, so they're only taking care of only allopathy medicines only, right? So they don't have such homeopathic Ayurvedic medicines, right? So that's why I think it's more related to
Yes.
allopathic only.
English medicines, I can say.
And this is just out of curiosity, Sunita, this is more of a mapping. So how does it make it different for the companies to hire a certified person or a fresher? So if we take a relatable example from IT, if they are hiring a fresher, so they train them on what has work has to be done in kind of internship of 3 to 6 months, and they get
Yes.
started.
Yes.
So how it is different? Just more of a mapping. It looks quite easy in seeing it. Maybe I'm wrong, but it looks quite easy in terms of seeing it. You just need to mention the symptoms or what exactly it is, and the mapping would come and just to map it. It's more of a data entry work. To me, it looks like that.
See, for you, it's looking like a data entry work, but for this, we need to follow certain client guidelines and organization rules. Simply, we can't assign the codes. You need to follow certain guidelines and rules, which
Okay.
may leads to compliance. If we are giving a wrong way of coding, it leads to compliance. You need to read the complete patient's information, like since from what time period he's having the problem, from date 1 till date 30, 30 days of reports you have to review completely. What is the problem, what patient is having previously problems, the complete report you have to read thoroughly.
Okay, got it. Yeah, thanks for clarifying that, Sunita. So my another question is, like you said, the eligibility does not restrict you in case you are not a life science graduate, right? It could be for life science and both non-life science. So in the life science also, I see the eligibility mentioned was more of a BSc in microbiology, kind of MSc, BPT, that kind of thing, right? So do you see doctors also in this field of medical coding? Like if somebody is doing MBBS or BDS,
Yes, yes.
yeah.
Actually, there is a like clinical investigation similar to medical coding only.
Hmm.
For those clinical investigation, doctors are required. So Optum is the only one company. Optum previously it was called as United Healthcare. So that is the only company where they are having a project called clinical investigation. So for that, they are hiring the MBBS doctors. So in that department, if you go through the profiles of every person, all are MBBS only.
And how about BD?
Not only MBBS, but they are also like physiotherapy doctors are there, like that also we can say.
And do they take BDS also?
Yes, BDS, all dental doctors, all they are having a graduate of doctorate, definitely they can.
Mhm. You mentioned about three kind of certification: outpatient, inpatient, and the specialties, right? So, if you could just help me, what's the cost in the INR in for falling for all these three category certifications? How much does this cost in India INR rupees
75 to 80,000.
for each of them?
Yes. They almost.
No, I think
Sev-
it is not that high. It must be somewhere around less. Can you just check again?
1 second. See, for CPC certification,
Can you
it
open that
depends.
slide? Just where you have certification, can you open that slide? It would be relatable to us. Yeah. No. Yeah. No.
Yes, it's
Yeah. No, go slow, go slow. Yeah. Yeah, Sunita. Go ahead.
yeah. See, for CPC certificate, the cost is around now it is almost $883 with the GST. So in Indian currency, how much it will be? Around $800 means it's around some 75,000. It is coming to the other thing, that is CCS certification. It is around CCS certification is around $250. Actually, why it is showing 250 means that is only for one attempt. If you write for 2 attempts, then the cost will be more.
And for the third one?
Third one, even I'm not aware. I'm just aware of this CPC and CCS.
Okay. Because before joining this session, I was just curious to figure out. So I was just out of
So,
curiosity checked
so
CPC.
general.
So
So,
it's
like,
yeah. Go ahead.
so the more cost will be for the CPC.
But it was showing somewhere around $322, and the membership
No,
cost
no,
at
no. That
$200.
is like previous one. Right now, in the year 2025, in the July, August month, the cost is revised. You can check it in the AAPC website.
Oh, okay. Is it?
Yes.
Maybe that would have been the old one in that case.
Exactly. The one which it is showing, it is an old one. Recently, in the August and July month, the cost is revised to $883. Why? Because that is for the 2 attempts. In the first attempts, it is not qualifying. You can write for the second attempt. So the cost which it is showing now in the Google, that is a wrong thing. Why? Because the cost is revised.
How typical are these certification exams?
If you will be like perfect with the training, then it will be not a typical thing, I can say.
Okay.
Okay, then I have another session to join. So I'm winding off the session.
Yeah,
Thank you.
thank you so much, Sunita, for sharing these detailed insights about this. Much appreciated on your part. Thank you so much.
Thank you. Thank you. Okay, like if you want to join the program, from tomorrow onwards, it's a paid certification program. I'm hoping you will be joining.
What's the offer price going on for this?
With the videos, 18,000. Without videos, 15,000.
With videos and without videos means the recordings?
Yes, exactly.
Would it be lifetime videos of with us, or it will be some
No,
time
no,
stamp?
no. It is, we do have a time for 1 year or 2 years, we'll be giving the access.
And who will be your trainer? Would it be you or somebody else?
Me only, I'm the
Okay.
trainer. So I
Okay.
have total of 10 plus years of experience into this medical coding. I did the work in Optum, R1 RCM, IKS, in all those MNC companies, healthcare companies. I worked almost for 10 plus years.
Great. Just the last question, Sunita. If you could share any contact number of yours or email ID in case we do have any other query or somebody in our contact and they want to just clarify. So is it any way we can contact you again?
Yeah, 1 second. Actually, I can't provide any contact of mine. You can contact the team, Durga Software. So they will be giving everything. And also, like, you can watch my demos, seminars, which I gave for the Durga Soft students. You can go through those, like in the demo 1, demo 2, demo 3, what I have taught. You can go through it. And if you want to join from tomorrow, it will be the paid demo.
It will be a
Paid one. From tomorrow
uh-huh.
onwards, the link will be changed. Why? Because these are the paid from tomorrow onwards, the session will be paid. And this is the one, the link you can go through it.
But
So
I
I mean,
think, Sunita, I would suggest like if you are giving 1 and 2 extra demo sessions, that will be, I think, at least people will
you
get to
can
know.
go through the YouTube videos. Already I gave demo 1, demo 2, demo 3. You can go through that. I have shared the link, one of the video link of mine, which is there in the YouTube. If you type over there, you will be getting my other demos also, the continuation of seminar. So first day will be the seminar, remaining 3 will be the demos. So that is the thing I have given already. You can watch through that. And if you want to join, please, you can join from tomorrow and the link will be changed.
how
And
many
thank you.
classes would be taken up in case we plan to join it? How much of hours duration? In a
Only
week?
1 hour. 1 hour.
1 hour daily or how it is?
Yes. Daily 1 hour, Saturday, Sunday off.
Okay, and for how many months?
2 months.
2 months. Okay, so around 44 sessions in total.
Yes. So
Of
I'm running out of my time.
yeah,
Already it's
yeah, I
5
can
minutes.
understand. Yeah.
I do have other session where I have to join with my students. Thank you. Thank you.
Thanks, Sunita. Yeah.
Okay.
Thanks,
Okay.
Sunita. Yeah. Thank you.
Thank
Bye.
you. Thank you.